Included his answer. The member for O'Connor.
Thank you, Mr Speaker. My question is to the Minister for Human Services. Will the Minister please update the House on the results of the independent evaluation of the cashless welfare card and the government's plans to expand the operation into new regions? How has the government's approach been received by local communities, including in my electorate of O'Connor?
The Minister for Human Services.
Can I thank the member for O'Connor for his question? As members would be aware, we've been operating trials of a cashless welfare card in Ceduna and the East Kimberley for 18 months now. And the aim is to reduce the very significant welfare-fuelled alcohol, gambling and drug abuse that unfortunately operates in these communities. Indeed, as the initial conditions report said, these communities were at crisis point and had faced a steady decline over the last 5 to 10 years. Mr Speaker, last Friday we released the final evaluation of the trials, and it showed that the card was making a considerable positive impact and turning these communities around. In relation to alcohol abuse, for example, 41% of people were drinking less. There was a decrease in the alcohol-related hospital presentations of 37% in Ceduna. There was a 14% reduction in apprehensions for public drunkenness and fewer referrals to the sobering up centres. There was evidence of a decrease, Mr Speaker, of the number of women who were drinking while pregnant. Half of all people said they were gambling less. Half of all drug takers said they were taking fewer drugs. There was also other broader benefits, Mr Speaker, which were documented in the final evaluation, and it included that people were reporting that they were better able to look after their children, and indeed 45% of people said they were better able to save money. There was also a decrease in the decrease in requests for emergency relief, and there were reports of more baby and children's products being bought at the stores. The local senior sergeant, Mr Speaker, said that there was one prominent park where, and I quote, "You can now see children playing and families sitting down, where previously we would be attending there virtually every afternoon for brawls." Mr Speaker, these are incredible results. The East Kimberley leader Ian Trust, who led the advocacy of the card, said that he hoped that in 20 years' time we would look back and say that this was the defining moments when things started to change for the better. And every indication, Mr Speaker, is that he may be proved right. Last week, the Prime Minister and I announced the Western Australian goldfields in the member for O'Connor's electorate as the next site for the card. The goldfields, Mr Speaker, like other regions, has extensive problems with alcohol and drug abuse paid for by the welfare dollar. And I commend the member for O'Connor's advocacy of this card and for bringing together his community around it. It was welcomed very widely by community leaders. Perhaps the most powerful comment of support came from Betty Logan, an Indigenous woman and local councillor, and I'll finish with this point. And she said, and I quote, "We know it will help make a difference to young kids' lives. Kids are neglected and parents are out of control because of excessive drinking.